Well, hello, everyone. Joanne Williams here with Anxiety Simplified. And I really want to thank you for being here and being loyal listeners. I'm seeing that more and more, and I do appreciate it. But I am here to really share some powerful strategies I have used with my clients as a 30-year mental health professional to lower their anxiety simply. There can be simple ways to do this. It doesn't have to be that hard or a struggle, but I'm bringing it right into your own home or car. So I hope you can really use these techniques, these recommendations, or reach out, please. So, summary of today's show is about sleeping better, even with anxiety, and 15 ways to improve your sleep. It seems like sleep is not a necessity, where sleep is a necessity. And yet we seem to feel like we can do without any the necessary sleep without consequences. And I'm here to tell you today that is not true. And I hope you hear this because it really can be detrimental. But I'm going to talk about 15 ways to make your sleep better, even with anxiety, creating those ruminating thoughts that go round and round in your head at night that keeps you from sleeping. Have you ever done things that you would never have done if you weren't sleep deprived? My daughters still kid me to this day about when I practically tackled somebody that was trying to take our seats that we had saved at a morning seminar when I didn't get enough sleep. I'm telling you, I am not the same person without sleep. Are you? Think about it. Sleep deprivation is when you don't get the sleep your body and mind needs. And it's estimated to affect 1/3, 33% of adults. And it's only worsened in recent years. Lack of sleep directly affects how we think and feel. Just like me tackling people. That is not me. While the short term impacts are more noticeable, like that, chronic sleep deprivation can heighten long term risk of physical and mental health problems. So, here's 10 reasons why you want to figure this out to get better sleep. Sleeplessness causes accidents. I'll go into a little bit more detail later. It dumbs you down. It can lead to serious health problems. How about lack of kills your sex drive if you are sleep deprived? And sleeplessness can be a symptom or one of the symptoms of depression. And here's an important one. Lack of sleep ages your skin. How about sleeplessness makes you forgetful? Yuck. Losing sleep can make you gain weight. The effects of sleep deprivation and sleep deficiency can be serious and far reaching. So, acute sleep, which is more in the short term, raises the risk of unintentional errors and accidents. Drowsy driving, which involves slowed reaction times and the risk of micro sleeps. And it can be life threatening. A 2005 Sleep in America poll found that 60% of adult drivers reported driving while drowsy in the past year. Survey data from the CDC indicates that 1 in every 25% have fallen asleep behind the wheel in the past month. So drivers beware. And according to the National Traffic Safety Administration, in 2017, drowsy drivers lead to at least 91,000 crashes, resulting in roughly 50,000 injuries and 800 deaths. So this is serious. People who are sleep deprived are more likely to struggle in school and work settings, or to experience mood changes that may affect personal relationships. If I was tackling somebody in my family, that might have not gone over, or well, like they haven't forgotten it. But chronic sleep deprivation long term can contribute to a wide range of real health problems, and it plays a role in the effective functioning. Sleep plays a fundamental role in almost nearly every system in our body. So, a persistent lack of sleep creates a significant risk to physical and mental health, cardiovascular disease. Studies are showing that strong associations between sleep deficiency and heart problems, including high blood pressure, coronary heart disease, heart attacks, and stroke. Diabetes, it affects the body's regulation of blood sugar, increasing the risk of diabetes. Obesity, researchers found that people tend to consume more calories and carbohydrates when they don't get enough sleep, which is just one of the several ways that poor sleep can be tied to obesity and problems maintaining healthy weight. How about sleep deficiency can worsen your immune function? And we all are working on our immune system right now. But how about including poor response to vaccines? And that's what we're doing right now for COVID-19. So getting good sleep is really important for your body basically to accept the vaccine. Hormonal abnormalities. Sleep helps the body properly produce and regulate various hormones, potentially increasing susceptibility to hormone problems in people with sleep deprivation, even pain. Sleep deprived people at a higher risk of developing pain or feeling that their pain is getting worse. Pain may further cause sleep interruptions and create a negative cycle of worsening pain and sleep. Mental health disorders, sleep and mental health are closely intertwined, and poor sleep has strong association with depression, anxiety, and bipolar disorder. So think about this and how this might be affecting your life, your mental health, your anxiety, or your depression. And I will go into more in our next podcast about techniques that really can help both of these with sleep and anxiety and how to do that. So, given these diverse and important impacts of sleep deprivation, it comes as no surprise that studies have shown insufficient sleep to be tied with greater overall risk of death, as well as a lower quality of life. And on a societal level, the impacts of sleep deprivation are enormous. Sleep deprivation has been calculated to incur hundreds of billions with a B in added healthcare costs, as well as over 40 billion in productivity losses per year, just in the United States alone. So I think you get it here. This is really, really important to deal with. So here is 15 Ways to Sleep Better by Michael Martin from September 3, 2020. And you might think about your parents or grandparents rising early and talking about needing less sleep as they get older, and you might find yourself having trouble sleeping after 40. But it's a misperception, according to Michael Martin, that we should sleep less as we get older. And in fact, according to the American Academy of Sleep Medicine, at 40 to 60, we need the same amount of sleep as we did in college. So sleep is not a waste of time or something you grow out of, and it can extend your life and the quality of your life. So, getting less than 7 hours. All of us, young and old, are sleeping less and less, and it's bad news at any age. According to the Gallup poll, the average American is sleeping 6.8 hours nightly, and 40% of us sleep less. 40% sleep less than 6 hours, and this is a problem. Adults, even older adults, need at least 7 hours, according to the National Sleep Foundation and the American Academy of Sleep Medicine. If you're staring at a screen an hour before you go to bed, don't. Cell phones, TVs, and computers emit a blue light that can keep you awake. It disrupts your natural circadian rhythm, which tells you when it's time to turn in and goes through the different cycles in your sleep. So, averting your eyes from TV, phones, computers, or tablets at least 60 minutes before lights out for the best sleep. And consider pretending that you live in an earlier time, advises the National Sleep Foundation. Wind down by reading, writing in a journal, or chatting with your partner. Pillow talk can be really nice and help you connect with your partner, anyways. Don't drink late at night. Alcohol might seem like an effective way to ease into your sleep, but consuming alcoholic beverages too close to bed actually hinders your rest. Researchers have found that alcohol shortens the deep or the REM sleep, which makes sleep less restorative. So stick to 1 to 2 drinks nightly and don't use alcohol as a sleep aid. It's just counterproductive and doesn't and can lead to dependence. If you're snoring, loud snoring isn't just a pain for anybody that can hear you. It can be a sign of serious health problems, namely obstructive sleep apnea or OSA, because breathing actually stops for as long as a minute before your brain wakes up and to resume your breathing. And this causes pauses in your breathing. And that can happen many times a night. Sounds scary? And it is. The OSA has been associated with high blood pressure and other health problems, and it's exhausting. This is one you must talk to your doctor about, because think about it. If you're just waking up to breathe, how many times does that happen? And you may need a sleep study for them to actually see the impact. And there is now ways to help with that. Don't use sleeping pills. Think again. Sleeping pills are entrenched into our popular culture. You see them on the bedside table in movies, but that doesn't mean they're good for you. You shouldn't need to rely on medication to get sleep, even over the counter ones. Some studies have linked the use of sleep inducing drugs to increased risk of cancer and death, because people, again, can drink and use these and it can affect your respiration. So researchers aren't really sure why this may be, but why risk it? Instead, figure out some new ways to relax and slow your mind. And I want to share from a survey I did with my clients what was the biggest challenge with having anxiety. And number 2 challenge with anxiety was getting good sleep because of difficulty shutting off the brain. So I'm going to share 3 things I can suggest to use to lower your anxiety mindset or those ruminating thoughts. Because I consistently hear from my clients that these ruminating thoughts keep them up and impair their sleep. And one thing I think it's really important to process more of this worries in the daytime. The more you can actually let go, and learning some let go skills and not allow this to be processed at night can be very important. If you are a chronic worrier, this really can affect your day and your nighttime sleep. For instance, if you're still hashing over a meeting at work or a conversation that you had with somebody that you didn't feel like got resolved, or if you feel like you shoulda, woulda, coulda said something else and you keep thinking about what it is, then learning some letting go skills of those what ifs. What if I would have said this, or the ruminating thoughts about going round and round, to refocus. Refocus. Don't allow this. Stop that circulation thought. Refocus these thoughts elsewhere and focus on something peaceful and calming and reassuring, or just feel it in your body. Sit with it for a moment and let it go. Just notice where you feel it in your body. Kind of sit with it and it will leave. And you can just sit there at your desk, even put your hand where you might feel it, and you can let this go in as short as 10 minutes. So here's another one you can try if this sleep time is difficult because of these ruminating thoughts, is progressive tense and release of different muscle groups starting at your toes to your head has been shown to not only reduce your physical muscle tension and stress, but it helps to refocus those thoughts onto your body. So you would just start at your toes and just clench kind of and release slowly, and I'm going to do it kind of just, and you go to your next set of muscles at your legs, your calf, and your toes, and then up to your thighs. Again, tense, and do it slower than this. And then release and keep going up till these major muscles, in your lower back and your butt, and release slowly. And keep going into your abdomen. Feel all of your organs. Again, just relaxing as you release this. So feel it, think about it, focus, and keep going all the way up. Feel your shoulders. That's really a place that a lot of times we hold tension. Maybe drop them, breathe in and then let them drop. But tense and a release all the way up to your neck, into your head. Tense your face. You can do wiggles with your face, make funny faces, massage your head. It's surprising how much tension we can hold in our scalp. Tense and release. You can add a breathing technique of counting your breath in through your nose to a count of 4, and exhale out to a count of 8 with your out through your mouth, so it's even pursed, to a count of 8. And do that in a set of 4, breathing in through your nose to a count of 4. Count out your breath to a count of 8. Do this, and you're going to notice you're actually doing something that is a profound relaxer because it stimulates your vagus nerve to excrete a relaxing, calming chemical called acetylcholine. I'm going to do a whole podcast on the vagus nerve, but look it up. It is amazing. And this breathing stimulates the vagus nerve, and that will send a relaxing chemical into your body. Create a nightly practice of meditation. If you create a space for yourself, and I have a whole video on creating a space for meditation, and it's a podcast you can find, because if you find a place, and maybe it's not in your bed, but maybe it's in your bedroom or someplace peaceful, have a nice chair, put a headset on, listen to some music, and light a candle, have some ambiance, and you are going to start to create some vibrations in that vicinity. So when you do this enough time, when you come there, you'll just automatically start to feel this letdown and this relaxation. So I'm not going to profess in the short term that this is magic or anything, but building new habits of releasing worry that you are actually building up if you are not releasing them through the day. But you can use these to shift these ruminations into a more peaceful place. Number 6, afternoon naps. If they're too late in the day, don't do it. If it's after 5 p.m., don't do it. It's really harder for you to sleep later. If you do want to do a shorter nap, do it early, like 1 o'clock. Siestas around different cultures have been shown to make more productivity in the day, but do it early. Don't go to sleep on a full stomach. Eating a full stomach too close to bedtime increases your risk of acid reflux and indigestion, which can lead to snoring or insomnia. So eat at least 3 hours before bedtime. And if you do need a late night snack, stick to something light like cereal, bananas, and milk, and you can see more in articles about what is the perfect bedtime foods. And they're usually carbohydrates, it seems like. Change your pillow. I thought this was interesting. Your pillow should be washed every 6 months and replaced every year to 2 years, according to the National Sleep Foundation. The reason is dust mites. These microscopic critters and their waste can worsen allergies, asthma, and impair breathing, and therefore your sleep. Place this pillow, which is really a device to support your neck and head, which as we age, that degrades, so you're not getting the same amount of support. And more than half of us experience neck pain as we get older, which could be alleviated by purchasing a new pillow that properly cradles your head and neck. And so just make sure you do wash your pillow in a separate load and dry it completely so that mold does not develop, maybe with a tennis ball, clean tennis ball in there to help with that process. Number 9, wash your sheets more often, because dust mites again can nestle into their bedding, and that doesn't mean you need to throw them out. Some sheets and pillowcases can last for decades, depending on the quality, but experts recommend you wash your sheets at least every 2 weeks, weekly, if you suffer allergies or asthma or eczema. To prevent these dust mites from inhabiting your mattress, use a protective cover and wash that every 2 months. No sleeping with pets. Oh, I'm a pet person. Oh, that I do. I work with people to get emotional support animals, which one of the daily functionings that they can absolutely help is sleep. But let's figure out a better way than sleeping in your bed, because if you do share your bed with a dog or a cat, you may be suffering from poor sleep and daytime tiredness, because the animal can be causing worse sleep. According to a study at the Mayo Clinic, sleep disorders, 53% of people who sleep with their pets have disrupted rest and abnormal sleep patterns because of their four-legged friend's restless behavior or the real estate they take up. So if you could have a basket next to your bed where you could, reach down and pet them, but put them there, it's really good for their independence as well. So see if you can work it out so they don't sleep, next to you, maybe next to you on the floor. Get enough exercise. We hear it all the time. Exercise doesn't not just leave to trim our waistline. The studies are showing that it can improve your sleep, helping you fall asleep more quickly and have better quality of rest. And researchers don't know exactly why that it works. And the science is clear, though, that you shouldn't exercise 1 to 2 hours before you go to bed, because of the endorphins need to have time to wash out of your system. But getting as little as 10 minutes of exercise a day has been shown to lead to better shut-eye, warding off sleep inhibiting conditions like sleep apnea, restless leg syndrome, both of which can get as more common as you age. If you notice you're tossing and turning, experts recommend that you get out of bed. Just get out of bed after 20 minutes. Do not torture yourself trying to do things after 20 minutes. Just get up, do a calming activity like reading, book, or listening to music until you feel sleepy, and avoid the screens. Number 13, don't sleep on your stomach. Some stomach sleepers experience pain because they position and twist their body out of alignment. And you do have to sleep with your head turned to the side, which makes it harder to breathe and put strain on your back or your neck, or raising your risk of neck problems or even a herniated disc. And since neck and back problems do increase with age, you might want to avoid that sleeping on your stomach. Or if stomach sleeping is your thing, sleep with a thin pillow or no pillow and place it under your pelvis to take the strain off your spine. Number 14, if you're sleeping too much. Sleep is vital, as I've gone through, for health as we age, but there can be too much sleep as not a good thing. Oversleeping has been correlated with increased risk of dementia and depression. That is a symptom in depression if you're sleeping too much. It's an avoidance coping. So notice that. Or just your low motivation, you just rather sleep. Again, animals can really help with that. Psychiatric service dogs, especially, if they will get you out of bed. Stick to 9 hours max and wake up at the same time every day. And I hope this helps you to relax more and with sleep to enhance your health and lower your anxiety with these recommendations. But by no means are they a replacement for therapy or any kind of medical attention. Please reach out for sure. And if you are ever feeling like you want to hurt yourself, and put this number in your phone. If it's not for you, maybe it's for a friend or family member that you'll have it ready to just give to them. And this is a hotline for depression, 1-800-273-8255. Or just know you can always go to an emergency room or call 911. And remember to practice these. And thank you again for listening. We really do appreciate it. And show your support by rating, reviewing, and subscribing to Anxiety Simplified. And share it with somebody who you think this might help in some small way. And you can contact us at anxietysimplified.net, or to find out more how to get an emotional support animal for housing or a certified psychiatric service dog to go everywhere with you to feel the calm. Bye for now.